Thank you so much, Dow. All right, so, surgeries like on the spine and back, they're an intricate process, but now new technology such as the O-arm system are helping make precise surgical navigation possible. Joining us now to talk more about it, Dr. Yevgeniy Khavkin, the Director of Spine Neurosurgery Program at Centennial Hills Hospital, and also here with us, Shelby Vincent Jr. He's the first patient to benefit from this technology at Centennial Hills. Welcome to the both of you.
Thanks very much, Hal. Thanks for having us.
The O-arm imaging system at Centennial Hills Hospital, the best way I could have explained it before going into this conversation was, is it kind of like GPS for the body?
That's exactly right.
Oh.
I'll give you a little background. So over the past year, I have been working closely with Centennial Hills administration to look at various technology to make the spine neurosurgery program the most advanced program in the state at Centennial Hills Hospital. And you know, I was very fortunate with my training. I trained at Johns Hopkins University. I was the head of the neurosurgery spine program at Northwestern. So I've always had access to cutting-edge technology, and since I moved to Vegas about 3 years ago, I felt it would be very important for people in Las Vegas to have access to such state-of-the-art technology. So the O-arm is not necessarily a magic cure to the spine problems. It's just a device that allows us to have a better precision in surgery, to facilitates what we do. It reduces potential complication rate. It shortens potentially hospital stay, and overall, it's a great technology that helps patient care.
The older technology you can only see in 2D space, so you saw a flat image, and you're like, okay, well maybe that's there. But now the O-arm lets you see in 3D, so you got the X, Y, the Z axis, and you can get down to the exact. That's exactly where we have.
That's exactly right. Yeah, in other words, it's a three-dimensional CT-guided navigation system in surgery that allows us to do what we do. The
technology is amazing, and this is the first hospital in the state.
Centennial Hills is the only hospital in the state that actually has the technology.
So this benefits you greatly because now you can know with much more certainty exactly where the problem is. We're actually taking a look at the situation right now, and this is an O on an arm.
Yeah, so you can see a picture taken during the surgery. You can actually see the actual O-arm. And there's a patient on the table, and this O-arm looks like an O around the patient, and it takes this three-dimensional image of the patient that we're going to be using as a guidance during the surgery.
Now, Shelby, let's talk about you. What was the problem that you had that led you into surgery?
I had a disc that was bulging. I've got degenerative disc disease that I've had for several years, and I spent about 3 years trying to find other solutions. Got with Dr. Khavkin, and he suggested an epidural as kind of a final step, and I was either burn the nerves or surgery. Yeah. And so we decided to go with the surgery.
And how are you feeling now?
I feel absolutely wonderful.
That's great.
Huge success.
Now, what was it like knowing that you were the first person in the state to have benefited from this technology?
It didn't bother me too much. I had a lot of faith and confidence in Dr. Khavkin. He made me feel real comfortable with going into the procedure, and I was glad to be a part.
And you get to take home see a certificate and a picture of what they found?
Yes.
That's pretty cool. Does everyone get that, or was that the special?
No, actually, Shelby was not a special patient selected for this. He's just one of our many happy patients
Luck of the draw.
who happened to be on the schedule the day when the O-arm became available.
That's great.
And I'll tell you, Shelby's story is a great example of what this spine care is all about. Because a lot of the patients who have spine problems with the neck or the back caused by the deterioration of the disc, and you have a pressure on the nerve, pressure with the bones rubbing against each other. And fortunately, most of the patients get better without surgery. You know, we have a comprehensive non-surgical program including physical therapy, pain management, chiropractic treatment that allows most patients to get better. Now, those who do not get better, some of them might benefit from the surgery. And the surgery that we usually perform for patients like that consists of the combination of taking the pressure off, which we call decompression, as well as stabilization. So we mobilize the spine and we eliminate this abnormal motion. And that's called fusion. And so a lot of times when patients hear the word fusion, they get scared because patients hear these horror stories about back surgery not working. But I would always tell my patients, and I used to tell my residents, my fellows in Chicago, is that it's all about the decision making. If you do the right surgery for the right patients, they do great.
Absolutely.
And Shelby is a great example of that.
Well, I'm glad you're feeling better, Shelby. Now let's talk about the special event that's happening in June.
Right, so there's a health fair that's taking place at Centennial Hills Hospital. I believe it's June 2nd. And there's going to be more information.
June 1st.
June 1st.
Saturday, June 1st.
And there's going to be more and more information on this technology as well as everything else that's available, which is very exciting.
Absolutely. And you're going to be providing free health screenings there as well, which is excellent. Right. If we want more information on the hospital, how do we find it?
You either can call my office, the number on the screen for consultation, or call Centennial Hills Hospital, and we'll be happy to give you more information about this.
All right, it's a pleasure to have the both of you here. I'm glad you're feeling better.
Thanks for having us.
Me too.
You made him feel better.
He sure did.
That's the most gratifying part about this.
That's a pretty awesome job.
Absolutely.
Thank you so much for the both of you joining us. Again, if you want more information about Centennial Hills Hospital and this first in the state technology, head to the website on your screen. And by the way, happy 5th anniversary as well. All right, still ahead on the Morning Blend, your chance to relax and